Hi, my name is Heather Edwards. I use she, her, hers pronouns, and I am making this video to help give people who are trans and non-binary, and then also medical providers who work with trans and non-binary people, easier ways to talk about genitalia when you're in the office. I am a pelvic physical therapist, and so I work with people on issues of urinary stuff, bowel stuff, sexual function, pelvic pain, and support or prolapse issues. And so I have to talk about this stuff a lot, and sometimes it can be kind of awkward. One of the ideas that's kind of out there that is, I think, a really great idea is for the client. So if you have a trans or non-binary client, or if you're a trans or non-binary, to be able to have your own words available to use for your genitals. The thing I've run into with this, though, in the office is that it seems like when I've asked, some of the answers have been, I don't really call it anything, or I don't really have any words for it, which is a little hard. And then sometimes if people actually do have words that they've come up with on their own that feel good for their bodies, usually those are words that are more used with intimate partners, which those are not exactly the words you want to be talking about with your doctor. So I have a kind of a little bit of a workaround that I just wanted to share in case it helps anyone out there. So what I like to do is get a piece of paper, and if you are trans or non-binary, this is a really great skill to be able to learn because you can kind of communicate without having to use words a lot quicker. Also, if you're a doctor or pelvic PT, gynecologist, PA, or midwife or practitioner that's working with anyone, this could also be a really quick and easy skill to help get past any sort of language barriers. The example I'm going to use today is for genitals that would generally be assigned female at birth. But you'll see with kind of what I'm doing, you can really kind of make it, like adjust it to be anything. Yeah, so there's a big variation. So we're starting with a blank page here, and I'm going to just adjust the screen down a little bit here. Okay, so what I like to do as far as learning how to draw this is if you just imagine it kind of like where the center of the page is. So we're just going to draw kind of a little rainbow at the top, up like this, and then kind of look at where the bottom center of the page is, and let me just this a little bit, and kind of start again in the center and just kind of make two curves that come out here. Okay, so we have kind of a basic crotch going on. And so again, using genitals that are generally assigned female at birth, I'm going to start with the clitoris or the erectile tissue. And you can kind of make this like whatever size feels appropriate for you. And then the urethra, so a dot, and then the vagina or the introitus, or you can also call it the canal, underneath that. And you can see it's kind of like a U and then an I and then an asterisk. That's the anus. And so from here, what we're going to do is just create the vestibule. And so this is just kind of a little area that sort of surrounds all of the kind of the issues that are down deepest in that, in the vulva or the crotch area here. This is kind of a place that's of medical significance, which is why I like to point it out here. And then we'll have the labia minora, kind of starts up here with the hood, and labia minora, but also the inner labia, because they come in all sorts of different sizes. They're not always the smaller ones. A lot of times they're bigger than the majora, which we can also just call the outer labia. And if labia is also a term that seems too gendered, then you can use folds. So we've got the clitoris or the erectile tissue, the urethra, the vagina or the introitus or the canal or the opening to the canal, and then the anus. And then we've got the vestibule, which is kind of this part inside here. And then we've got the inner folds or inner labia, and then the outer folds or outer labia. These are the ones that grow hair, just as far as if you're looking to see what's going on here. This is where hair is, and sometimes down here. And then the inner labia or the inner folds are the ones that don't grow hair. So if you're checking yourself out, that's kind of how you can tell a difference. If you have a new vagina and you are a trans woman, then you might not have the inner labia, and it might be a little more connected here. So if you're looking in a mirror, that's what you're going to see. And so if you go into your doctor and say I am let's kind of bring it back here, say I am a trans masculine person and I have a beard and I looked for all purposes like I am a cisgender man from the outside. And when I go into a doctor's office, I have to come out as trans because they're going to assume that I'm a transgender man or a cisgender man if I haven't actually put the right information on the medical forms, or they didn't have the right information available for me to put on there, or they didn't look at the medical or the forms, the intake forms. So what I could do is I could just go in and I can have my picture ready. I can even make a little wallet card out of it so I can just whip that out and have it available. And then I can say, all right, so here's what my body looks like, and this right here is where I'm having pain. And so we don't even really have to use words. If you know where everything is on your body and you can point to it, that's going to give your doctor a heck of a lot more information than trying to explain like where the redness or the itch is down there and trying to figure out what words are appropriate to use for down there. I also have so all the words I just threw out on there, here they are. So, for your external stuff, you can say vulva or crotch or external genitals. For the inside part, vestibule is the word. And then for we've got the vagina or the canal or the introitus. We've got the outer folds, inner folds, erectile tissue, clitoris, and then the inner and outer labia, and then the anus at the bottom. All right, so I hope this has been helpful. If this video will probably live on my website that is vinoandvulvas.com. And there's all sorts of other, if you kind of like the idea of doodling crotches, I'm all about it, and I make my own. So here is an example of one that what fun you can have with it when you start drawing crotches more. So vinoandvulvas.com, www.vinoandvulvas.com. And that's where you can find me. You can also send me any email or messages from there as well. All right, thanks a lot, and I hope this is helpful. Bye.